Hi, I'm Robert Tigner with Origamic Solutions. Today we're going to talk about cultivating resilience in first responders through emotional intelligence. This is a two-part series on the impact of emotional intelligence on our first responders and medical personnel. It's imperative that we offer this self-awareness and training as early in the career as possible so they can grow and reassess periodically to ensure appropriate skill development. Welcome to part one, where we begin to explore a couple of the facets of emotional intelligence and their impact on our first responders. First responders, the police officers, firefighters, EMTs, nurses, and doctors who stand on the front lines of our emergencies, consistently face high-stakes, emotionally charged situations. The ability to remain calm under pressure, make critical decisions swiftly, and connect with individuals in their most vulnerable moments is paramount. While technical skills and physical prowess are undoubtedly essential, a robust foundation of emotional intelligence provides the crucial background for navigating these intense demands and fostering long-term resilience. So the EQ 2.0 assessment that we offer at Origamic Solutions offers a comprehensive framework for understanding and developing this vital capacity. So let's start to explore a few of these facets and how they directly impact the lives and effectiveness of our first responders. First, self-regard, the anchor in the storm. Self-regard, defined as respecting oneself and understanding one's strengths and weaknesses, is a cornerstone of resilience for first responders. In professions where mistakes can have life-altering consequences and where constant exposure to trauma can erode self-worth, a strong sense of self-regard acts as an internal anchor. First responders with high self-regard are more likely to maintain confidence in their abilities even after experiencing difficult or unsuccessful calls. They can acknowledge errors without internalizing them as failures of their core self. This allows for learning and growth rather than succumbing to self-doubt and burnout. Studies on stress and coping in emergency medical technicians have shown that a positive self-concept is associated with better psychological adjustment and lower levels of post-traumatic stress symptoms. For instance, an EMT with healthy self-regard might analyze a challenging call, identify areas for improvement in protocol adherence, and implement those changes without letting the event diminish his or her overall sense of competence. Similarly, a nurse who experiences a patient death can acknowledge the limitations of their control while still valuing their efforts and skills in providing care. Next, we talk about empathy, bridging the gap in a crisis. Empathy, the ability to understand and share the feelings of others, is not just a desirable trait for first responders, it's a critical skill that enhances their effectiveness and fosters trust in high-stress situations. Empathetic first responders can better assess the emotional state of victims, patients, and their families. This allows them to communicate with greater sensitivity, build rapport quickly, and provide more effective support, even beyond the immediate medical or safety needs. For law enforcement, empathy can de-escalate tense situations and foster community trust. Research in nursing has consistently demonstrated a positive correlation between empathy and patient satisfaction, adherence to treatment plans, and overall well-being. Imagine a firefighter who, after extinguishing a house fire, takes the time to listen to the distraught homeowner, acknowledging their loss and connecting with their emotional pain. This act of empathy can be as crucial as the physical rescue in the immediate aftermath. Similarly, a doctor who conveys empathy to an anxious patient in the emergency room can significantly reduce their stress and improve the cooperation with medical procedures. Developing emotional intelligence as a path to enhanced resilience. The good news is that emotional intelligence is not a fixed trait. It can be developed, enhanced through targeted training and self-awareness practices. For first responder organizations, incorporating emotional intelligence assessments and tailored development programs can be a powerful investment in the well-being and effectiveness of their personnel. This can include workshops focusing on self-awareness, emotional regulation techniques, communication skills, and stress management strategies. Peer support programs and mentorship initiatives can also foster a culture of emotional intelligence and resilience within these demanding professions. By recognizing and nurturing the emotional backbone of our first responders Through the development of facets like self-regard and empathy, we can empower them to not only navigate these intense challenges they face, but also to thrive, ensuring they remain the best possible versions of themselves for their own well-being and for the communities they so bravely serve. The EQ provides a valuable roadmap for this essential journey. To learn more, I look forward to your comments and shares, and please reach out to me at origamicsolutions.com for more information. And look for part 2 coming soon.